Higher health insurance bills have thousands of New Mexicans worried as leaders in Washington battle over extending tax credit through the Affordable Care Act. Today, U.S. Senator Martin Heinrich sat down with some people who say skyrocketing premiums will hurt their wallets. News 13's Bianca Hoops has the story.
As New Mexicans and people across the country are enrolling to renew their medical insurance, some say they are seeing their premiums double in price.
I expected $200, $300, maybe $500, but it was almost a $1,500 increase for our family.
Las Cruces resident Amber Romero shared how much more her health insurance company will charge going into the new year. She says she is considering going to Mexico for health care in order to save money.
So my husband and I have talked about possibly only insuring our minor children, and the two of us, we live in Las Cruces, maybe going to Palomas.
Romero is one of the 3 people who sat down with U.S. Senator Martin Heinrich today, expressing their fear over increasing health premiums.
I can't afford it, and I want to pursue my dreams.
Marissa Thompson says her monthly bill went up from $540 to nearly $1,000.
I had to spend an entire 2 days out of my life researching, comparing, and then calling all of my doctors to say, do you take this new insurance? Because I'm switching from one provider to another.
As Washington argues over extending federal Affordable Care Act tax credits, the New Mexico legislature has stepped in with $17 million in state subsidies to make up the difference. State officials say this will support most of the people enrolled through Be Well to keep their coverage affordable. But for some making a higher income, they'll still face higher premiums. Senator Heinrich says he is planning on sharing those stories when he returns to Capitol Hill.
I think there was a general misunderstanding of what the scale of this problem is, and I think that my colleagues are going to get an earful for the next several months.
Bianca Hoops, KRQE News 13.
State tax credits to offset the lost federal subsidies are based on an income scale, but lawmakers say that only covers the gap until July. They're hoping Congress will act and start covering the subsidies again.